Hello everyone, it's Business B.E.A.R podcast time. I hope you're ready for another exciting installment as I have brought to you another incredible group of people to talk to today. Today we're going to be talking about Mountain Laurel Medical Center, what they are, who they are, and what they have on the cooker. Before we get there, exactly what is this? This is the Business B.E.A.R podcast, the absolutely free business and economic show endorsed by Garrett County Business Development. It's an absolutely free program, so if you want your business featured on the program, give me a call or email me at 301-334-7281. The email cnorman@garrettcounty.org. Again, 301-334-7281. Email cnorman@garrettcounty.org. Now we're going to get started, but I want to remind everyone that any views or opinions expressed by the guest or their host are their own and are not that of Garrett County governments or Garrett County Business Development. So, Mountain Laurel Medical Center. It says their mission is to provide quality, safe, accessible primary health care, wellness promotion, and education to all individuals in Garrett County and the surrounding areas, regardless of a patient's ability to pay. Here to tell us all about it, I've got the experts with me. We've got Executive Assistant and Marketing Coordinator Stephanie Walsh with us, and we've got their CEO, Mr. Brian Bailey. Guys, how are you doing today?
Doing good.
Great to be here. Thanks, Connor.
So good to have you guys in the show. Thanks so much for coming to the office. I know we had a little mix-up on where we should be meeting. It's my fun little small studio here, and I am so thrilled to have you guys and be talking about Mountain Laurel Medical Center today. It's Friday. It is absolutely stunning and gorgeous outside. I have to say, I'm super lucky. I love talking radio. I love talking podcasts. You can't spend an afternoon any better. What do you think?
I agree. This is a great day in Garrett County. It's beautiful out, and we're pleased to come here and talk to you about what we're accomplishing in the community and the opportunities that we have, and frankly, just share some information about where we're going, exactly what your intro was all about. So we're excited to be here.
Exciting stuff. Thanks so much, Brian. So speaking of you guys, tell me a little bit about yourselves. We're going to break you guys down and your roles with Mountain Laurel Medical Center. Let's start with Stephanie.
So I started with Mountain Laurel in March of 2019. I started at the front desk as a patient access specialist and did that for about 2 years or so. And then in March of 2021, the executive assistant position opened up. So I reached out to Brian and let him know I was interested. And luckily that worked out. And so I was the executive assistant for a year. And then the marketing position opened up. And I said, I think I can do both if you let me do both. So I've done that for about a year and a half, and so far so good, I think. So it's going well.
I would say so. I don't think there's a part of the county I can go to without seeing something Mountain Laurel Medical Center. So good job on your part.
Thanks.
Brian, let's hear about you.
Thanks, Connor. I've been here at Mountain Laurel for about 4 years now. Transplant from Baltimore, but had been coming out to this area for about 15, 20 years and
Awesome.
realized the value of living out in this wonderful area. So moved out here about 5 years ago and have been the CEO there for 4 years. We've done a lot of work over the past 4 years, and we're here today to talk to you about some of that work and some of our other opportunities and expansion that's going on there. But the Mountain Laurel team is a great expanding team of awesome providers, awesome support team, and bringing people like Stephanie on board and then elevating them through the organization is another one of our major objectives.
Well, great. I think you hit the nail on the head. It's a beautiful area to live. Garrett County, it makes sense. I'm a transplant to this area myself. A lot of listeners to the show are surprised. Many people think I was just hewn from the foundation of Garrett County. Not true, not true. I'm from the Detroit, Michigan area, but I've had family here going way back. So welcome to the area. Of course, after so long, you're a local, Brian. Come on. Stephanie, you homegrown or are you a transplant as well?
No, I'm also a transplant. Me and my now husband moved here in 2018 for his job, and I initially worked at Wisp Resort for a little bit and then decided that I wanted to look for a little something different, and I saw the opportunity at Mountain Laurel, so took that, and it worked out really well. Weekends off has been very nice. So and then I get to enjoy all of the surrounding areas, like all the state parks and everything like that.
Yeah, absolutely. Nothing like grabbing that cup of coffee in the morning, looking out the window, seeing the trees, the mountains, going outside, having that beautiful mountain air, and then having that drive to work where you can experience the same exact thing. So that's nice. Well, guys, we could talk about Garrett County all day, but we're here to talk about Mountain Laurel Medical Center. Give me a general 101. Let's do a brief overview, and then we're going to drill down and learn specifically about each program and what you guys have got going on. So give me the 101 of Mountain Laurel Medical Center. What is it?
Sure. Mountain Laurel Medical Center is what's termed a community health center.
Okay.
We are an organization that is funded partially by the federal government. That funding enables us to be the safety net provider in the community. What do we mean by safety net? True to the mission that you mentioned beginning in the program, our funding is to take care of those who are uninsured, underinsured, or experiencing problems connecting to healthcare because of their insurance status. While we are the safety net provider, we're also there for anyone who wants to be a patient of Mountain Laurel. We are there, we accept Medicare, Medicaid, all commercial payers, but really our mission that we want to stress is that we are there for those who have trouble accessing healthcare or do not have insurance. So that is a privilege to be in this community in order to offer that service. So it is a federal designation. We certainly accept all insurances, and we also pursue other avenues such as grant funding and other sources of income that help us support what we call enabling services. So while we have a great team of clinical and behavioral health providers, we also have nurse care coordinators who are there to help coordinate your chronic diseases. We have community health workers who work with our social agencies such as Community Action to connect people to housing, for food insecurities and other social issues.
Yeah.
And we also have transportation that we offer to our patients. So we like to think that we give you no reason that you can't access care.
Yeah.
If it's because you don't have transportation, we'll pick you up. If it's because you don't have insurance, we will see you. If it's because of any behavioral health concerns or anxieties, we have behavioral health associates who can help you through that. So kind of think that our objective is to be as accessible as possible for the patient and make sure that they are seeking health care regardless of where you go. If you come to Mountain Laurel, that's great. Our community relations team will also connect you to any healthcare provider you would like. If Mountain Laurel is not your flavor, we will help and assist you to connect you to whatever flavor you would like to go to in the community.
Wow, incredible.
Our important mission is that you connect to healthcare.
Yeah.
If you choose Mountain Laurel, what a privilege for us, but we're just happy that you're connecting in healthcare one way or another.
That's fantastic. Appalachian people, you learn very quickly. They're a sturdy bunch, sometimes not always willing to connect with those health services. So it's nice we have an organization that's helping to advocate to them to make sure that they do get that right fit, that they're coming in the door when they have those needs.
Correct.
So it's really good to hear that you guys are doing that. So now we'll break down maybe the specific areas of Mountain Laurel Medical Center. But before we do that, you guys have got a couple locations out there. Tell me about the regions you're serving and the people you're serving.
Yeah, so our what we call our flagship practice was opened back in 27 in Oakland. We were actually on Memorial Drive and the lower level of what is now Regional Eye Center. So we kind of started small.
Wow,
there.
yeah.
And then the CEO at the time had a great vision of building a practice. And so our current largest practice is in Oakland on Memorial Drive behind the health department, a great partner of ours.
A beautiful building, too.
Beautiful building, which we expanded about 5 years ago. And so that building has continued to grow, and as have the services there.
I remember being at not only the groundbreaking, but the ribbon cutting for that. I know.
You've been here a while, haven't you guys?
Oh, yeah. I've been around the block when it comes to most of these things.
I think you were at the ribbon cutting for our expansion too when we opened side B.
Yes, that's true.
So you're a part of Mountain Laurel's history too.
Oh, of course. Happy to endorse you guys. I mean, you guys have been doing incredible for a long time. So, yeah, that's great. Sorry to interrupt.
No, please. Shortly after that, about 3 or 4 years after that, we were invited to Grantsville to open up a practice in Grantsville. We kind of look at ourselves as the community invites us in. If there's a need that's identified in the community and they invite us, it is our obligation to circle back with them and check to see whether it is a demonstrated need. So we established our practice up in Grantsville about 9 years ago. That one is pretty much bursting at the seams right now, and we're actually looking for an alternative expansion site for Grantsville.
Okay.
About 4 years ago, we opened our Western Port site. So that is down on Western Port Road across from, down the road from Kaiser and Piedmont on the other side of the river. But we opened that practice about 4 years ago, another growing practice that we continue to add providers and resources there. In fact, in a couple of months, we'll be adding a pharmacy to that site.
Oh, wow.
So on-site pharmacy like we have in Oakland. So that is the continuum. And the great thing about Western Port is that we opened shortly after the Luke Mill closure.
Mm-hmm.
So as the safety net provider in the community, those with insurance or without insurance, we were there to take care of those patients, again, regardless of their ability to pay.
Yeah.
So the timing was great for that community down there, that we could be their healthcare provider. So we've been, after 4 years of really working through that, we got an invitation to talk to some friends up in Brewston Mills. So about 9 months ago, I met with the owner of Brewston Family Medicine, and through our discussions, we came to the conclusion that we were a similar cultures, similar mission, and that the owner wanted to expand services up there, but the resources that she had were more limited than ours.
Yeah.
So after 6 or 9 months worth of discussion, about 2 weeks ago, we opened in Brewston Mills.
Oh, congratulations.
So that is our fourth practice, our first venture into West Virginia, which we're excited to be present in, because certainly our geographic adjacency to West Virginia, Pennsylvania, Maryland, and we see patients from all 3 states in that site. So that expansion was another important advancement of our mission, and at that practice we have added a physician as well as a psychiatrist and a licensed social worker. So more services coming to a community that invited us in, that asked for those services, and we're fortunate enough to help provide that.
That's great. And I can tell you the importance of having things like a pharmacy or access to those services in small communities. Without them, they can really make or break a small town. So being able to have that provision, it makes the area more attractive for people to come in. And how great that you guys are offering that too.
Absolutely.
And those buildings are very distinctive. I don't know, you guys are quite on brand, I have to say. You can tell a Mountain Laurel building just by driving by and seeing it. If you haven't seen it, you need to check out their locations in Brewston Mills, Western Port. You need to go up to Oakland, Grantsville. Check them all out so that you can see what I mean there. Here's a little question for you, Stephanie, now that I'm thinking about it. So you have a large dynamic area. How do you connect with these communities to make sure that they know what you guys have going on?
I think kind of like what you mentioned of just trying to be everywhere, as many places as possible. I
like it.
Yeah, I want someone to say, I see Mountain Laurel everywhere. So, and I think, again, what you hit on, just being consistent with our branding, so that when you see that heart-shaped logo, that you're like, that's Mountain Laurel, and just using like a variety of platforms. We're on social media, where we do print advertising, we do radio advertising, we do billboard advertising. And I was telling someone a story a while back, because given that I'm a millennial, I was like, in newspaper, it can be a little expensive to advertise, but I understand there's obviously costs associated with that. But looking at our invoices, I'm like, we spend a good amount. Is there, value in that? Is that something we should continue to do? And then a couple weeks later, I was visiting my grandparents in West Virginia, and on my grandpa's, next to his chair in the living room, he needed a tree cut down. And he had cut down in the newspaper where they had the advertisements of who cuts down trees in the area. So I saw that and I was like, this is why we have to do it, because that is where there is a a large population
absolutely.
who that is still where they get their information. So that's one thing where in our area that I need to be aware of and mindful of. Social media is not the end all be all for Garrett County. You do have to be diverse in the way we advertise.
Yeah, and that's a very good point. As a radio man, in other areas it may not be the hottest medium. In fact, in many areas it probably is declining. But in an area like this, it's only on the rise and super relevant. Things like the newspaper, radio, they're highly sought after for immediate news to connect with the community. And around here, you definitely have that demographic that relies on it. I know every week I'm picking up the paper to check out what's in there, what news I can catch up on. And yes, I also have a book behind you there on the shelf that is just full of cutouts of businesses that I need to go and see or services that I need to take advantage of. You talked about someone that cuts down trees. I'm going to have to connect with your grandpa now. Get that clipping so that I can call those people. So fantastic. And it's good that you guys are doing the expense to make sure that you're available in the mediums that the people are using. Thank you for that. And around the area, you said your grandparents are in West Virginia. I endorse Garrett County, but there are friends and family on both sides of that border. West Virginia up in PA, it's kind of a regional approach, and I think that's true for any side. Let's drill in on these services now. If I was to see one of your Mountain Laurel ads, and I need to connect to your medical services, what are some things I can walk in the door and expect from Mountain Laurel?
I think the number one thing that you will see with Mountain Laurel is that commitment to customer service.
Okay.
Our team realize that many of our patients who want to seek care are experiencing not only physical issues but also behavioral health issues. So that sensitivity to realizing that most people enter healthcare because of they're not feeling well. And so that sensitivity to those patients to address their needs, whether they have challenges on the physical, mental, or disability challenges, the team is there to accommodate. We are there to make sure that your entrance into Mountain Laurel is seamless, that it is respectful, that it is culturally sensitive. And so being respectful for those who may feel underserved or unappreciated, our team does a terrific job of making sure that we are respectful to you regardless of your social status, of your economic status, of your religious faith-based issues, whatever that is present there. So to expect to be treated with respect, to be expected to receive the same level of services regardless of whether you're insured or underinsured, that is what I believe that our mission is and that we excel at. So accessing our healthcare services, we have a new electronic health record that we went live with about 2 weeks ago.
Wow.
We are
what an undertaking.
Hoping to leverage the capabilities of that electronic health record and evolve the technology associated with that to make it very patient friendly. So eventually patients will be able to request schedules, request appointments, have a portal where they can check their electronic health records for any updates on lab work, etc. But engaging the patient so that they understand how they can access information and how we can provide health care is a balance there. So expect that we will do whatever it takes to accommodate the patient to make sure that we achieve their health goals, whether they be on the clinical side or the behavioral health side. But expect us also to have wraparound services that, as you mentioned, pharmacy. Our objective is to have on-site pharmacy at every site eventually.
Wow.
If not partner with every pharmacy in the community to make sure that we're accessing low-cost drugs for them. Expect that we will have integrated behavioral health so that if you, in the course of your encounter with your medical provider, if you express anxiety or depression, that the behavioral health team is also there to be part of the clinical team to help you through that encounter. Expect that if you have a need of insurance, that we have insurance navigators on site who can help connect you to insurance. If you express homelessness or food insecurities and other issues like that, expect that our community health workers will help you connect to those social services where you need that care. But in the end, it is a team-based care effort. We are designated what's called a patient-centered medical home, which means that the team-based care of the medical providers working with the behavioral health providers, working with the nurses, working with the MAs, and frankly, the whole team at Mountain Laurel, that we recognize the whole person, our whole team recognizes the whole person, and our objective is good quality care at the end.
Fantastic. Technology is an important piece, and it sounds like you guys are integrating. You said you were updating your system. How important that is to stay modern, to stay relevant with the ever modernizing world. That's fantastic, and it sounds like you have people that, updating technology can be scary. I know. They changed the color of my phone app, and I didn't make calls for a week until someone showed me what it was. It sounds like you've got staff right there that are going to show them how to use this stuff, simplify it, keep it in small terms so that they can access that up-to-date information and have access to the best care. So that's great. You guys have a very robust primary care unit. Are there any specialized services that you guys offer as well?
Behavioral health is probably the next specialty level of care. But our clinical team is well versed in managing some very specific chronic diseases. So our medical team and our nurse team we have a diabetes self-management education program to engage people in their chronic diseases and make sure that we're managing their glucose levels, their blood pressures. One of the programs that we did, for instance, were for people with uncontrolled hypertension that
Wow.
we deployed blood pressure monitors to their homes. And our community health workers monitor their blood pressure regularly, whether it's daily, whether it's weekly, whether it's monthly, so that we can track how their hypertension is when they come into the office. And you can imagine some people's blood pressure goes up in the office.
Yeah. I'm one.
Versus what is your blood pressure in a normal resting state at home. So it's not just engaging them while they're at the practice, it's engaging them at home also, because people feel differently when they're in a more comfortable environment.
Yeah.
So those chronic disease management and patients that we help manage through an episode of they have just left the emergency department and they need follow-up care, we do that. They've just gotten discharged from the hospital and they need to see their provider very soon after that. We have a team that reaches out to the patient to arrange for a follow-up appointment so they don't show up back in the hospital or back in the ED unnecessarily. So that continuous monitoring, that continuous care, and that continuous communication is another level of care that we make sure that we take care of carefully. Our relationships in the community are very important with the other healthcare providers.
Mm-hmm.
We are family practitioners and behavioral health practitioners, but our relationships with all the specialists in the community, the surgeons, the orthopods, the endocrinologists, all those other, we partner with them. We have a referral team that upon order from your physician, our referral team then works to make your appointment to that cardiologist or to that orthopedic physician. So, ensuring that you seek that other level of care, our referral team is there to help you make those appointments and hopefully what we call close the loop and make sure you follow through with that appointment so we get the results back. So
very good.
It's not just our care, it's ensuring that you get care with everybody that we refer you to also.
They'll follow up on it too. You'll get a call from the referrals team that'll say, a couple months ago you were referred for this service and we haven't gotten anything back. It looks like you didn't get it done. Why didn't you go?
Oh, wow.
But then if
Good.
you say, if there's a reason, my insurance changed and it was going to cost me X, or, where you scheduled the appointment was too far, or inconvenient for me, or this, that, and the other, we'll, as Brian mentioned, we'll work to overcome those barriers. Well, what changed about your insurance? Can we get you on the sliding scale, which he might have talked about, but we have an income-based sliding scale where We offer it to all patients, so no matter what insurance you have, if you qualify for it, it'll reduce the cost of an office visit. We ask patients to bring in their, tax returns or pay stubs or some proof of income, and with that and the size of your household will determine where you qualify. There's different levels, but again, that's something that we offer to make sure that that's not something that's a barrier to care as well. And another thing that we also launched, as if all of this hasn't been enough, in July we launched imaging at our Oakland practice.
Okay.
July 6th. So just shy of 2 months of that, and our X-ray technologist has already performed over 220 X-rays, and that's
wow.
At the Oakland practice. So that's been booming as well.
Yeah, that's
lots
huge.
going on. Yeah.
Wow. So you guys are becoming more self-serving right there in the facility. Now, this is out of the Oakland facility?
Yes, at the Oakland practice, yeah. As Brian mentioned, eventually one day it's something that, as if the need's there, we'd like to have at our other practices. But we started in Oakland because, as he said, it's our biggest, and it's been going really, really well. I think our patients do appreciate, again, it's something that helps them adhere to their care plan. If your physician sends you an X-ray order and they say, can you go get it done at, another place, and you show up and there's 5 people in front of you, there's a chance that you might be like, forget it, and walk out the door.
Yeah.
Whereas if we can just walk you down the hall and say, there's one person ahead of you or there's no one ahead of you, let's go ahead and get it done. Then,
fantastic.
Yeah, again, it's something that helps them stick to the plan.
Again, as we said, Appalachian people can be quite sturdy. Sometimes a little convenience goes a long way,
Yeah.
and that definitely serves that purpose. So let's talk a little bit about your guys' involvement in the community. I know you guys are out there all the time doing something. I've seen food drives, I've seen clothes drives. You guys are just incredible. Can you tell me a little bit about what you guys have going on out there?
So we do have a community outreach team. Each location has a dedicated community health worker, and then we have 2 who are more operations focused, and so those are who you see out in the community all the time. They're partnering with the Ruth Enloe Library, with the Allegheny County Library. They're popping up at grocery stores just to sit in the parking lot, and with our van that has our big recognizable logo that says,
yeah.
hey, if you have a question, come talk to us. If there's something we can help you with, come talk to us. We have partnered with other organizations like the Possibility Shop and Cumberland, and those things like that, where it's just what can we connect people to, what resources can we make them aware of to make sure that they're well-rounded and getting everything that they need.
Yeah, that van, the community relations van that we have, frankly, it's nice. It functions as a mobile billboard, but it also functions as a mobile resource center. So those community health workers and the community relations team is out there educating the community on their options, making sure that we're disseminating information to them about where they can obtain healthcare services. If not with us, then where. We actually had a unique relationship with one of the other practices in Oakland where we had access to their scheduling system. And so if the patient said, I don't want to go to Mountain Laurel, I want to go to this other practice, we had access to that other practice scheduling system, and we scheduled into their system. Because again, the important thing was that they access healthcare, not that they just came to Mount Laurel, but they were accessing healthcare. So kind of a cool partnership that we had, but
Very much so.
That community relations team is, you'll see them often in community events such as parades, but more often they are attending block parties at Garrett Land. They are attending senior centers doing education.
Blood pressure.
They're out there doing some of the public stuff, but the behind the scenes stuff where we're working with the elderly community or the community or others, that is really the impact that they're making. And Stephanie is humble, but she and the community relations team are the ones putting out all that great information in the community that is culturally sensitive. As Stephanie mentioned, whether it's print, social media, whatever, we are accommodating so that the community is there to receive our information in a respectful way, and that we can work with them to process that information and achieve their goals.
You guys have a lot going on. I imagine this takes a big team. How many people do you guys have with you?
We have 130 employees now at Mountain
Incredible.
Laurel. With the addition of Brewston Mills, that added another 10 employees. And we continue to grow and look for other growth opportunities.
So where are those growth opportunities? Are you looking for people to join you down there? You're probably after some professionals, aren't you? It sounds like a big team, but you've got a big operation. What are your needs?
Um, on the clinical team, healthcare industry is ever changing, and people are always looking for new healthcare opportunities, or actually just moving out of healthcare into others. So we do have continued recruitment for medical providers, behavioral health providers, but also the clinical support team, particularly medical assistants is one of our hot recruitment places. And the front desk, we call them patient account specialists.
Patient access specialists. We are always recruiting. It's what I started as, but it is a position that we're recruiting for quite frequently, and part of that is because it is such a great entry position. When I started, I didn't even know the difference between Medicare and Medicaid, and so it's great to get your foot in the door, learn about the healthcare industry. We have a lot of people still with the organization who started as patient access specialists who have grown to other positions. One of our patient access specialists, she's actually now our county manager. We have another one who is now a data management specialist. We have another one who just recently became a medical assistant. So,
Wow.
which is, it's not always a track that we see, but I think she decided that she wanted to move more into the clinical side of things. So, that's always an option as well. So like I said, it is something we're always recruiting for, and I get nervous that people probably see it on our Facebook a lot and they're like, why are they always filling that position? Like, what's going on? But that's why, is because so many of the people, who start as the patient access specialist are still with the organization. They're just doing other roles.
Yeah, they're advancing themselves within Mountain Laurel, which is fantastic. So
Yeah.
you're not just joining a team in an entry level position. You're joining a team that's willing to invest in you and expand. I'm sure you guys have a lot of that.
Yeah, and as we kind of talked about today, with all of the expansion, there's always new positions that we're creating or didn't have previously, to aid in all of this expansion. But it is just a great company to work for. Of course, we're biased, but as I said, having weekends off is huge, and everyone can appreciate that. But Mountain Laurel does a lot for its employees. There's a lot of services that we offer. Our benefits package, I would say, is very competitive. We have medical, dental, vision insurance. We have employer-sponsored short-term disability, which is amazing. We do, just a lot for our employees. We have tuition reimbursement. We have loan repayment. So if you're someone who is thinking, I want to be a medical assistant, but, school's expensive. Like, come to us and, apply for that position, say I'm interested, and, it's something that we can discuss to see if that's something we can offer. So there's a lot of great benefits that, PTO is great. I love PTO. So you can never have enough. So I think we offer a generous PTO amount, and it's there's a year of service amount with it. The longer that you stay with Mount Laurel, the more you get. So it's something that encourages people to stay, which again is something that's tough in the employment industry right now. People are hopping, so we got to find reasons to convince people to stay.
Fantastic. So we talked about a lot today. If anyone wanted to learn more, whether they want to become a patient, whether they're looking for a job, whether they just want to learn more about Mountain Laurel Medical Center, where would they go? Now, do you guys have like a website? Do you have telephone number? What is it?
So we do have a website. It's www.mountainlaurelmedicalcenter.com. You can also get there by www.mtnlaurel.org. Either one will get you there. And I try to keep that pretty updated. And then I would say probably the best is Facebook. That's going to be the most up-to-date current information. And so, again, that's just search Mountain Laurel Medical Center on Facebook and you'll find us. We do, of course, have a phone number. So that's 301-533-3300. That'll get you to our main office, and they'll be able to connect you. But each office does have its own telephone number as well. And so, yeah, but I would say Facebook is probably the best to keep in touch.
Great. No TikToks.
Not yet, but never say never. Can't you see Brian doing a TikTok dance?
They keep trying to push me there. You ever heard that term face for radio? We'll keep it at that. So, thanks so much for coming in, guys. You were excellent guests. We learned a lot about Mountain Laurel Medical Center today. At the end of every program, I give you guys a section to kind of plug anything, make announcements. Maybe you want to just reiterate what we talked about. I call it your time. So this is your time. Tell us what you want.
Yeah, I'd like to wrap up and just thank the community for their support. Our growth is really a function of their demand and their needs, and so that is what we are there to do, to function, to take care of the community based on what they need. And we also want to thank our collaborators in the community, those who partner with us in healthcare delivery, because it's really a team effort to improve the healthcare of the Garrett County residents, Allegheny County, Preston County. That is what we're there for. So that team-based care that you see at Mountain Laurel, we think that it's team-based care across the entire county. More importantly, I think we want to thank our fellow team members at Mountain Laurel, because it's really their dedication to the community and the work that everybody puts into this that makes it all happen. So our team members are equally important, and we appreciate them also.
Thanks again so much to the CEO of Mountain Laurel Medical Center, Mr. Brian Bailey, and the Executive Assistant Marketing Coordinator, Stephanie Walsh, for stopping in and talking with us today. Be sure to follow us at our Garrett County, Maryland Business Development Facebook page, Twitter, or X, whatever Elon Musk is calling it these days, and our LinkedIn page to find out everything business related here in Garrett County. Follow along for more episodes and so much more. Thank you folks so much for listening. This is Connor Norman, and we'll see you on the other side.